Sterile gloving and sterile field. Asepsis is the absence of pathogenic microorganisms. Medical asepsis will be a clean technique. You have a reduction of organisms. It requires you to wash your hands, wear clean gloves when handling body fluids, keeping fingernails short and keeping hair pulled back. Whereas surgical asepsis is sterile technique. It destroys microorganisms and their spores. Items that have undergone a process to eliminate all microorganisms is sterile. Hand hygiene compliance among healthcare workers is about 40%, according to Longton in 2011. Hand hygiene is not an option. If hands are not visibly soiled, you can use the alcohol-based hand rub, but soap and water should be used when hands are visibly soiled, before meals, after using the toilet. Exposure to spore-forming microorganisms such as MRSA, which is methicillin-resistant Staphylococcus aureus, or VRE, which is vancomycin-resistant Enterococcus, or Clostridium difficile. Recent researches show that routine use of antibacterial soaps can lead to the formation of multi-drug resistant organisms. In addition to hand washing with plain soap may result in paradoxical increases in bacterial counts on the skin. Alcohol-based products are actually more effective than soap or antiseptic soaps for hand antisepsis. Alcohol-based products do reduce infection, and it's recommended that you use alcohol-based products with emollients. Now, this is not to say that alcohol-based products take the place of good old-fashioned hand washing. Infection risks. Take a good look at these and remember them. When you start sterile, you stay sterile. If only sterile equipment is used, then sterility will be maintained. Always make sure that you inspect a package prior to opening. If anything within a everything within a sterile package is sterile. If it's torn, past the expiration date, or wet, it is considered to be no longer sterile. If sterile touches sterile, it stays sterile. Sterile touching clean or contaminated has then been contaminated. You can handle sterile objects with sterile gloves. If you're uncertain about sterility, then it is contaminated. If you're uncertain if an object has been contaminated, consider it to be contaminated. If you can't see it, it's contaminated. So if you turn your back on a sterile object, unlike what is indicated in the picture in your slide, then the sterile object is now contaminated. If an object is below your waist, it is contaminated. If part of the drape hangs off of the table or the sterile field, it is considered to be contaminated. Sterility is compromised by airborne pathogens. So if you have coughing or sneezing, it can contaminate a sterile field. If you reach across a sterile field, you contaminate it. Sterile drapes should be allowed to fall. Don't shake them out. Air currents can contaminate a sterile field. Gravity will dictate fluid flow. So when you are holding swabs or wet materials in sterile hands, and they are sterile, then you hold them down to prevent contamination of the hand that's holding it. Unsterile moisture contaminates sterile. If a sterile field is set up on moisture, moisture can wick into that sterile field and cause it to be contaminated. So there are some sterile drapes, though, that do have a moisture barrier. Edges of a sterile field are contaminated. You have a 1-inch border around the edge of a sterile field that is considered to be contaminated. Any items that are added to that sterile field should fall inside that 1-inch border. Gloves are going to help prevent the transmission of pathogens by direct and indirect contact. Nurses wear sterile gloves when they do several different procedures. Consider the nurse's client's possible allergies to latex, and remember that the powder inside the latex gloves contains latex particles, and when you remove those you can spread latex particles in the air that can remain for hours. Make sure that you select the appropriate size of glove. Be conscious of your hand position when you have sterile gloves on. It's recommended to hold your hands together, interlock your fingers, or as in the picture above, keep your hands above your waist during any pauses in the procedure, about a foot in front of you. If a glove touches a clean, contaminated, or possibly contaminated object, you have to replace them. Any tears in the gloves, replace them. So prior to putting on sterile gloves, you're going to wash your hands, open the outer package carefully without allowing the inner package to open or touch any contaminated objects. Lay that inner package on a clean, dry, flat surface, because remember, moisture will harbor and encourage bacteria transmission. Then you're going to open the inner package, reposition right to left, and it is indicated on the package, and open the package to reveal the gloves. So think about what is sterile and what is non-sterile. Everything inside that package is sterile until it's been opened and touched. When you're picking up a glove, you want to touch the inside of the glove only to keep the outside of the glove sterile. Sterile gloves are provided in the package with the cuffs folded up to allow you to accomplish this. So you use your non-dominant hand and carefully pick up the glove by the folded cuff. Then you're going to hold the glove with the fingers pointing down to prevent the glove fingers from flopping back onto your hand and contaminating it. Take care to only touch the inside of the glove. When you have that glove on, then you're going to slide your gloved hand inside the cuff of the other glove. You'll pick up the glove, holding onto it inside that fold, and then you will slide your other glove into it. This prevents you from touching the sterile hand to the unsterile hand. Now, if your fingers are not in the correct place within the glove, wait to adjust it until both gloves are on. To take gloves off without contaminating yourself, you'll grab a hold of the glove near the cuff with one gloved hand and carefully pull that glove off. That glove should turn inside out, so take care not to touch the glove to any exposed skin. Hold that soiled glove in the palm of your gloved hand, and then using your ungloved fingers, slide it inside the cuff and peel that glove off inside out. The first glove should remain inside the second glove. Make sure you dispose of it appropriately. And your sterile field. Remember, your surface should be dry and clean. Your sterile packages have folded tabs. Make sure you open away from you first, open each side second, and open toward you last. Many sterile packages are going to be in peel packets, so peel those open and you can pop them onto a sterile field, or peel them open and allow the person who is sterile to remove it.